Sakaja today appeared before the Senate Health Committee to table submissions on allegations of negligence and malpractice at Mama Lucy Kibaki Hospital following the death of Maureen Anyango.
The hospital has been at the center of alleged negligence of patients leading to their death, with among the latest cases being that of Maureen Anyango, a 28-year-old who succumbed to post-maternity complications after undergoing a CS procedure leading to the delivery of twins. In the Senate Health Committee meeting held at the Parliament buildings, Nairobi County Governor Johnson Sakaja, alongside Mama Lucy health officials directly involved in the case of Maureen and those of Kiambu Level 5 Hospital, today tabled a report on their version of circumstances that led to her death.
In the case of Maureen Anyango, the preliminary autopsy findings were raised intracranial pressure, pulmonary edema, and anemia. In the background of preeclampsia and postpartum hemorrhage, pending toxicology and histology findings, of which we are still waiting for the toxicology and the histological findings. All appropriate and available care was offered to the patient.
According to the report, the patient began experiencing vaginal bleeding at around 1:20 p.m., hours after delivery, in which she was immediately reviewed. At 2:59 p.m., the patient was put under general anesthesia and no serious post-delivery complications were discovered. At 3:10 p.m., efforts to reverse the patient from anesthesia failed, hence the patient was maintained on mechanical ventilation. At 5 p.m. upon consultation, the decision for the critical care of the patient was made and a call made to Kenyatta National Hospital, but there was no ICU. Kenyatta University Teaching Research and Referral Hospital was contacted and gave a quotation of 200,000 shillings deposit, an amount that could not be afforded by the family to Maureen Anyango. Kiambu Level 5 Hospital served as an alternative solution, but at the same time, it was the onset of Maureen's journey to the grave.
They arrived at what time in Kiambu?
Just a few minutes after midnight, around 12:10. Yeah, 12:20.
The records from Kiambu indicate 1 a.m. So
let me clarify on that. You know, when you arrive in the hospital, you doesn't arrive at the gate, then you just hand over to anybody.
Budgeted for how many computers? In this budget for all the facilities to have the computers and the biometric to be used. There's much more. And I look forward for you getting that report from us in terms of what we're doing, and you hold us to account. The state of healthcare in Nairobi has been really wanting for years, for decades even. And a lot changed.
The group from Mama Lucy Kibaki Hospital said the mother lost her life because of lack of coordinated referral system in the county, a matter that is yet to gain clarity. Nairobi County Governor now wants the committee to give Mama Lucy Hospital more time to go back to the drawing board before settling for decisions that might render the hospital unreliable. The matter now stops to the committee as it works around the clock to end such incidences. Maureen Anyango is just one among the many who have fallen victim of alleged negligence by Mama Lucy Kibaki Hospital. The committee is committed on cracking a whip to get at the bottom of it all, including recommendations for a temporary closure of the facility. But the question that begs for answers is, will the efforts stop at salvaging the situation to stop further deaths from taking place? Cecilia Lubanga, Look Up TV at the Mama Lucy Hospital, Nairobi.